Hi, friends. Welcome to Take Care of Your Body by Rye. I'm your host, Rylan Rosano, psychology master's student, chronic illness advocate, two-time published author, and a girl who has a lot of questions, and I ask your favorite health and wellness professionals them. Join me every week for a new episode that ties back into taking care of our body, mind, and making sure we never give up on our dreams. I'll see you every Wednesday and Saturday, and make sure you hit subscribe, grab your favorite coffee, and we're about to yap about all things health, wellness, and being human. Hey everyone, today I'm here with Dr. Rezika. Hi, Dr. Rezika, how are you today?
I'm good. How you doing, Rylan?
I'm talking to you. I'm doing amazing. I mean, you're an amazing person. Thank you for being in the medical field in general. I think it takes a really special person. So, you know, the work
Of
you do is not easy. You probably deal with a lot of mean people too.
yeah, it's not easy, but it's definitely rewarding. Um, I'll say there's definitely many, many, many more highs than lows. So yeah.
You go home feeling like a superhero, right? Changing someone's life at least.
Yeah, of course, even if it's like something super small, any little way that I can make someone's life better or someone's relative's life better.
Exactly. Why did you choose this field in the first place? I mean, I want to start there. What inspired you?
Why did I choose physical therapy?
Come
Okay.
on, give me something good. Like, don't let this be that you just wanted to make good money. Like,
No, 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 no. It's not that I just want to help people. Okay, so there's two specific reasons.
okay.
The first specific reason was around the time that I was like finishing high school, starting undergrad. My grandparents were getting really old, really, really physically disabled. My grandmother has severe scoliosis, severe osteoporosis, arthritis. She like at this point, honestly, she could barely walk by herself. So yeah, and my grandfather, God rest his soul, he also, had cardiac issues. He had heart failure, he had CAD, which is coronary artery disease. And yeah, so I wanted to help them specifically because they weren't really like receiving the level of care that they, can be receiving. They
Right.
live in Bosnia and Herzegovina. So the quality of healthcare there is not really what it is here in the United States. So I specifically wanted to help them. That's the first reason.
Right.
Second reason is I've been in love with pediatrics in any capacity, majority of my life. My mom was a preschool teacher for children with special needs
Mm,
my entire life. I grew up always, spending my days off from school in her classroom. So I've been around children with special needs my basically the majority of my life. And as the years went on, I was more and more and more sure that this is what I want to do in my life. This is what I want to do in my life. I want to work with children with autism. I want to work with children with Down syndrome, children with cerebral palsy. And yeah, and here I am now doing exactly that.
and you did it. And I think like that's amazing. Like it turned from an idea to something that you get to do every single day. And it's rewarding probably knowing like these kids remember things. They're gonna remember you even long after they stop seeing you.
Yeah, for sure. Of course. I haven't been practicing long enough to, I guess, see those long-term effects on children. But I'm definitely looking forward to it one day.
Well, I'm excited to follow your journey and hear that. So, what do physical therapists actually do? I feel like there's a stereotype that we all envision. So, kind of walk us through a little day in your life a little bit. How much coffee are you drinking? Like, I can't even imagine what your schedule looks like.
Okay. I will say I personally don't like coffee. Yeah, yeah, I know,
Get
I
out
know,
the
I know.
Zoom right now. We're done.
My thing is pre-workout. So I
That's
I
fine.
like yeah, I dry scoop like pre-workout like in the morning before going to work, Not even like before going to the gym, before going to work.
Wow.
Sometimes before an exam, like I don't know. That was just my thing. Um but okay,
How to
so
survive med school, literally, pre-workout.
yeah. Um so stereotypes on physical therapists. I think everyone that I've ever met who is not in healthcare, and honestly, some people even in healthcare, they think a physical therapist is someone you go to when you have back pain or knee pain or shoulder pain or neck pain. You go into their office, they do a massage for 10 minutes, they give you some simple exercises, they give you a heat pack or a cold pack, and then you're on your way. That is what the majority of the world thinks physical therapy is. I will say that does exist, but that is probably 5 to 10% of what physical therapists actually do. And I'll say, in terms of public health, so public healthcare systems, public hospitals, for example, that is 0% of what they do. Um, Physical therapists, people don't know this, but physical therapists can treat heart conditions. Physical therapists can treat skin conditions. Physical therapists can treat burns. They can treat strokes. They can treat uh,
Nervous system conditions. I mean, let's go.
literally every single body system is treatable with physical therapy. Obviously, some require physical therapy more than others. You know, if someone has appendicitis, for example, physical therapy is not going to be as essential to them as someone who had a rotator cuff tear.
Right.
But everyone in some capacity can benefit from physical therapy for whatever reason. What I specifically do in physical therapy, since I mostly work with children with autism,
Oh,
we see things like coordination disorders. We see things like weakness. We see things like improper balance. We see things like cognitive deficits. So, a child who is 8 years old, for example, is severely autistic and struggles to go up and down the stairs on their own. How do we intervene? We guide them how to coordinate going up those stairs. That's what I specifically do sometimes. That's part of my job, but that's one part of my job. Very different from an adult coming in with lower back pain. I massage their back for 10 minutes and give them a heat pack,
give them a nice pack. I
10
mean,
minutes of exercise, and then on their way. That's not the gold standard of care, even in orthopedics.
no. Thank you for saying that.
Yes.
People have that in their mind, and I'm like, I think health and wellness in general is individualized. Like, even if, like, let's say everyone got a heat pack, the care treatment is going to be different.
Of course, and it should be different for everyone. You know,
I think that makes
um,
them a good doctor if it is different. I mean, why are you going to treat every single person the same? They're
exactly.
different.
No two patients are the same. No two diagnoses are the same. Even if it's labeled as the same diagnosis, it's going to affect the patient in a different way.
1000%. So how
Yeah,
is it like, I guess, working with children who, I mean, autism is a little tricky. I mean, sometimes there's outburst. How do you navigate that within the environment and make sure like your goal of treating them properly is intact? I want to like throw you a bone real quick. I know that's not on the question list. Sorry about that.
yeah, no, that's fine.
My brain just went there. I'm like, come on, here we go. Boom.
People actually ask me that very often. So autism is very unique in that you have to work around the patient's emotions and the patient's desires. So a 6-year-old child who does not understand what physical therapy is and they don't understand what you're doing with them, they see it as playing.
Right.
Maybe they want to play with a ball for 30 seconds and then they want to go over there and stim for 30 seconds.
Right.
Which, as a therapist, you need to understand. You need to understand the child's personality. You need to understand the child's habits. This is why it takes a very long time to build that rapport and build that relationship with the child and build the trust. It's very rare and unlikely that you are going to have very efficient and very effective treatment sessions early on. When you take on a case, take on a patient with autism, you definitely need to work your way into the child's trust. You need to learn what the child likes. You need to learn what the child doesn't like. You need to learn what triggers the child's stimming, what triggers the child's outbursts, how to manage the child's outbursts.
Wow.
It's
Take
definitely tricky.
a special person. So thank you for doing that. You help a lot of people.
Of course.
I'm just gonna keep hyping you up, but it means a lot to me. It's a hard field, and autism makes it more complex, I think.
Yes, for sure.
Oh, what are some everyday habits that may be putting people at risk for injury?
Hmm. I can name a lot. So to name one, people don't warm up. When they're at the gym, they're lifting weights or they're running or they're doing some kind of exercise that their body cannot necessarily handle. They don't warm up and they don't prepare for that. They don't work their way into it. That is one of the like major reasons why people get, for example, herniated discs. They get a slip disc in their spine and now they have lower back pain because they have a you know they went and got an MRI and now they have a few herniated discs, which it's not hard to treat, but it takes a really long time to recover from.
Wow. And I feel like sometimes people don't like the word recover. I think rest is another thing. There's a huge stigma around people just want to push through pain and push through the injury. I mean, have you
Yeah,
had a patient like that who
of
doesn't want
course.
to recover and then they hang out with you a little bit longer because they
I've had
did so
many
much?
patients. I've had many patients who did not understand the value of rest. Um, I see this many times from patients who had surgery. A few months ago, actually, when I was still working in orthopedics, I had a patient who had an Achilles repair after tearing their Achilles, and 2 weeks after their surgery, they're back on the bike. They're on the stationary bike, doing cardio. And I was warning them. I said, listen, this is not going to benefit you. You do not need this right now. You are not at this level. We are not in a rush. Um, I don't recommend doing this. And it was making their ankle worse. Their inflammation was persistent and it was very, very, very counterprogressive. So rest is very important.
No, I agree. And I think like people, again, don't like it because they feel like they're being lazy, but your body is so smart and your body knows what it needs. I feel like the human body will tell us. We just gotta listen.
Of course, of course, of course.
Mhm. So, what's the difference between normal muscle soreness and pain that shouldn't be ignored? I feel like this is a good one to bring up.
Yeah. So normal muscle soreness is very different in the reasoning of your pain. So normal muscle soreness is expected to come, 12 to 48 hours after exercise. And you said the other was persistent pain? Persistent pain, including at rest, is actually what we consider a red flag when screening for conditions like cancer.
Right.
Um, Patients who have pain that persists in all like positions, they can't find a comfortable position. The pain does not stop. It keeps them up at night. It's 24/7. This is telling us something else. This is telling us, okay, this might not be an injury. This might be, you know,
Right.
pathology. Um, and that at that point, that's when we start to monitor the pain, monitor the pain patterns, and if necessary, then we refer them out.
And I think like it's cool that other doctors collaborate with you. Like it's not just you, looking at one little piece of the puzzle. Like I know you guys probably like consult with other physicians.
Yeah, of course, of course, of course. When I was working in cardiac rehab, we were speaking with the physician, with the cardiologist, basically every day. Yeah, basically every day. This patient is currently on this many grams of this medication. This is their heart rate. This is their blood pressure before, after exercise. Are there any changes that we need to be concerned about? Yes. Okay. What are they? No. Okay. Let's proceed. Um, it's very, very, very important to stay in communication
Yeah, the
with
picture too. I love that.
yeah, yeah, for
Important.
sure.
So, I love this question. Why is movement so important for our overall health?
Okay. So I remember one of the quotes from my professors that motion is lotion. Movement is so important because if you don't use it, you lose it. From a muscular standpoint, from a cardiology standpoint, from a neurology standpoint as well. If your body is not using something, you are going to lose it.
I want that on a shirt.
What was that? On
So
a
I want
shirt?
that on a shirt. Let's make sure it's come on. I'll send you one.
No, movement is super important. Movement every day, walking, even something as simple as walking 30 minutes a day can be the difference between suffering in your 70s and enjoying your 70s. For example,
Go ahead. I'm ready.
uh yeah, I mean, well, like
I mean,
that.
that was your example. I mean, but it's so interesting though, because I feel like older people, like if I complain about my back to my grandma's like, "Oh, well, you don't understand my back pain." But like, could a young person have chronic pain that can't be improved by exercise or not be caused because of lack of exercise? Because I feel like that's something like, physicians like always are like, "Oh, make sure you're exercising," and sometimes you are exercising and you still feel like crap.
Yeah. I think at that point you have to consider other factors.
Right.
You have to consider pathology. You have to consider diet. You have to consider exercise habits.
Right.
Are you over exercising? Are you under exercising? Are you pushing yourself enough? Are you pushing yourself too much? You have to consider life habits in general. Are you sitting 8 hours a day? Are you sitting 12 hours a day? Is 30 minutes of exercise going to make up for that? Probably not. Is it going to help? It should. But is it going to eliminate that pain? Maybe you're not doing enough.
I love that. We got to be aware. So, what are some common mistakes people make when exercising? Now that we're on the topic of movement.
Mhm. People think people think pain is okay and needs to be pushed through. I would say not. I would say pain is not necessarily a honestly, I would say pain is never a good thing. The only benefit that I can take away from pain, experiencing pain, is knowing our limit and then setting that limit and then slowly working towards pushing that limit.
So, how do you know if a muscle's getting stronger? You shouldn't feel pain during that process, right? Like
You
if you
shouldn't.
say you're working with like a physical therapist and you feel like that certain muscle that you're working on being activated and you feel a little bit of maybe not pain, but you notice the muscles there. How do you know it's getting stronger versus, ow, this is pain? Like, how do you differentiate it?
Well, that's gonna take time.
Okay.
You know, you probably won't notice a difference in strength in one session or even two sessions. Three, maybe. That's when you start to develop, that neuromuscular recruitment. 10 sessions, definitely you should see the difference or
Okay.
not.
Okay.
I'm not even going to go as far to say 10 sessions. I'd say even 5 sessions could be the difference between a 1 pound dumbbell and a 2 pound dumbbell, which for some people is a huge difference. Um,
Okay.
so I think time and consistency is what'll tell apart, gains from pain.
Okay. So someone shouldn't consistently be going to PT saying every time I do this certain exercise, my left hamstring hurts more than my right.
If they're going to PT and doing this exercise that every single time hurts their left more than their right, they need to speak with their physical therapist about it, and their physical therapist needs to figure out why, and they need to figure out how to adjust to that.
Okay. Thank you for that. Because I think I read somewhere, someone was like, every human being has a leg that's stronger than the other, or more muscles that are stronger compared to the others. And I was like, what? That maybe, but that doesn't sound completely adequate, you know?
I wouldn't say that's true. I would say it's definitely, sometimes true for people to not be ambidextrous, for them to have better neuromuscular control with their right than their left, or their left than their right. But in terms of strength, I mean, maybe your dominant hand is going to be marginally stronger than your non-dominant hand, but it shouldn't be a significant difference in strength unless you're recovering from a surgery.
Thank you for clearing that up. That's why we have you on, right?
Yeah.
So is stretching before a workout necessary?
It depends.
Okay.
So there's two forms of stretching. There's static stretching, which is holding one position for prolonged periods of time. And there's dynamic stretching, which is kind of going through a range of motion, doing stuff like Frankenstein, stuff like high knees, doing like a quick stretch, just like getting your body moving. That's dynamic stretching.
Yeah.
I personally promote dynamic stretching before exercise and static stretching after exercise. A lot of studies have shown that route is more beneficial than beginning with static stretches and ending with dynamic stretches, or beginning and ending with static stretches.
Interesting. Wow. I might have to give these stretches a try. I don't like, I feel like you don't hear like dynamic stretching. I probably have done it and not known the name, but I just feel like I do typical stretching. Wow. Interesting.
Yeah.
What advice would you give to someone who wants to start exercising but doesn't know where to begin? Maybe they just recovered from an injury, they're trying to ease back into it.
Mhm. Um, so if your budget allows, I do suggest having some kind of initial guidance from a professional, whether it's a personal trainer or a physical therapist, if possible. If your budget does not allow, um, the internet is a very, very, very informative place. I think it's very important to ask questions, especially with the emergence of AI now. There's basically nothing you can't ask it.
I was gonna
Um,
ask you that. It's crazy.
yeah, you know,
Read my mind.
I mean, to start, you could go on, one of these AI websites and say, I've never exercised before. I want to lose weight. This is my weight. This is my height. This is my exercise habits, etc. And it'll develop an initial plan for you from there.
I love that. So is AI a tool you use when it comes to your treatment plans?
So personally, no. Um, I I learned a lot in school about treatment, and through my experiences with patients, I've learned what works and what doesn't work. I use AI for other things, more administrative and more like planning stuff. But in terms of actual treatment, I kind of use my own clinical expertise.
I like that. Yeah, I've been reading like people are using AI for medical reasons, and I'm like, I think the doctor's a little bit better. Why are we relying
If
on something
you,
that doesn't?
as a clinician, if you need to use an external source for treatment, then sorry to say, but you might need to reevaluate your capabilities as a clinician.
I second that. Second that right there with you. How can physical therapy help people living with chronic pain or chronic illnesses?
So if someone had lower back pain for the past 10 years, I wouldn't expect them to get better in 2 sessions with physical therapy, but um, it takes time to figure out what works and what doesn't work with the physical therapist. But in my experiences, every patient who has been consistent with their exercises that they're prescribed to continue at home, and with their weekly or bi-weekly checkups, um, has reported an improvement, even if it's a minor improvement, from, let's say, 8 out of 10 pain at worst. Now their worst pain is 6 out of 10. Obviously, it's not great that they're still experiencing 6 out of 10 pain, but it's better than 8 out of 10.
Right.
um so pain is very, very, very subjective. I would say pain is one of the hardest things to treat. It's definitely harder to treat than strength, definitely harder to treat than mobility, because it really, really, really depends on the patient.
And it goes back to health and wellness, and the human body's individualized, which
Yeah,
I
yeah,
like
for sure.
to agree with that because I think doctors try to think that you can treat one patient the same way and you just can't.
Yeah, no, for sure. And you mentioned chronic illnesses.
Yes.
So I don't necessarily consider this a chronic illness, but a diagnosis like cerebral palsy.
Right.
Now, if this child probably child okay, let's imagine a child who is born with cerebral palsy, very severe cerebral palsy. They probably will never walk in their life, but with consistent physical therapy and consistent training for the parents, the child's life and the parents' lives as easier can become easier and as easy as possible throughout the child's life, you know. um there's always a way to help, even if it's a minor way to help, even if it's just going to make the child slightly more comfortable in their wheelchair, or if it's going to make it slightly easier for the parent to move their child from the bed to the wheelchair. um And I think that's what makes a good physical therapist, being able to find those little things that can help.
It's not about maybe fixing it because chronic illness, unfortunately, some of these are really complicated and there's no cure, but it's about making it a little bit better. I like that because I think, again,
Yeah,
it's overwhelming and not feeling well sucks. And I like that at the end of the day, that's your goal to make your patients feel better a little bit at least.
of course, of course, of
Maybe you can't
course.
fix it. I mean, come on, you should. Come on, cure the chronic illnesses. Cure, come on, you're smart enough. But I
Maybe
think,
we can't, maybe someone who, is wheelchair bound, um, they're probably never going to run again, but maybe one day we could get them to stand, to stand with their daughter at their daughter's wedding, for example.
steps.
And that's those are things that have happened in the past, with aggressive, consistent physical therapy. We can make people feel more human.
Exactly. And less isolated too.
Of course.
Mean, so let's say someone does go to physical therapy and maybe they're in a body, where it's an invisible condition like POTS or another form of dysautonomia where your nervous system's impacted, or Ehlers-Danlos or whatever condition you can't see. What do you want to tell them? Because I feel like, for me as someone who's currently using PT as a treatment source, I walk in there and I feel a little guilty because like I see people that physically have challenges from the outside in wheelchairs. And I'm like, they probably need this more than I do, even though I know my pain is just as valid. Do you want to say anything to those kinds of listeners that I have probably tuning in today?
Yeah, for sure. I would say every single individual has a right to the highest quality of care possible. No matter how complex or serious your condition is, you deserve to live your life to the fullest and as comfortably as possible. I wouldn't compare myself to anyone else's condition because everyone is dealing with their own, you know, challenges. Um, yeah,
Love
I just wouldn't.
that.
Yeah,
It's isolating. I mean, you really get in your head and then it's hard to explain to people why you're there. But I think again, like if you need the support, you need the support, and there's no shame in that. There's no shame in that.
there's no shame at all. There's no shame at all. It is literally a human right. Everyone is entitled to the highest quality of healthcare possible.
How can PT support those living in maybe like a body with a complicated nervous system like I have, where, Ehlers-Danlos? I find that condition so interesting. I don't know if you know a lot about it, but it's crazy that people just have such flexible joints that also put, extra, I guess, work on their heart and lungs and stomach and everything because their joints are so flexible.
Hmm. Yeah, I actually personally never treated.
Go ahead.
So I would say, sometimes we're not just physical therapists. Sometimes we're mental health counselors. Sometimes we're life coaches.
Right.
Sometimes we are friends. Sometimes we are motivators. I have patients who come in and, maybe they don't even really need physical therapy anymore, but they more so, need someone who is there for them and like to guide them through exercise, just because they don't feel ready to be independent with exercise, which is completely understandable and completely fine.
And that's not something you want to force, because then they're going to come see you for injury, a serious injury.
Yeah, of course. Well, hopefully they don't experience a serious injury, but yeah.
Right. If you force your body to not, to push past its limits, then they're going to break their ankle or hurt themselves worse.
Oh, yeah, of course. Yeah, for sure. Yeah, for sure. Especially patients who do not have as much experience with independent exercise. For sure.
So, what advice would you give to someone who's nervous to begin physical therapy because maybe they're worried it's going to make things worse? They've never navigated it before. Do you want to ease some of their worries a little bit?
Yeah. So, I've definitely had patients in the past who, sorry.
Bless you? Or was that a cough?
No, that was a cough.
Okay. Well, bless you anyways.
Thank you.
Of course.
I've definitely had patients in the past who came into physical therapy very skeptic of what we do in physical therapy. I don't blame them, especially if this is their first experience with physical therapy, or if they've had a negative experience with physical therapy in the past. I would say every clinician is different. I understand that sometimes it's going to be hard to trust your clinician. But the vast majority of clinicians have your best interest in mind. They want to see you get better and communicate with them. If something does not make you comfortable, or if you feel like something is not right, let them know, because this is their life's work. To some extent, we live to provide these services to people.
No, I agree. I mean, how can your doctor know how you're doing if you don't tell them?
Yeah, of course.
You say you're fine.
Yeah, I mean, but I don't blame people for not trusting their provider, because there definitely are providers who are not truthful to the system, which I think sucks. But the vast majority really, really, really have your best interest in mind.
We just need to duplicate you, Dr. Rezika. So you can be everyone's physical therapist. Like, come on. The world would be healed. If everyone listening could start doing 3 things today to take better care of their body, what would it be?
Drink more water.
Oh, God.
You're
calling me out. Stop.
Even I slack on water, and I think almost everyone that I know slacks on drinking water. Right. Try to drink a half gallon a day. Okay. Like that's my advice. Try to drink up to a half gallon a day. If you're bored, drink water. If you're thirsty, drink water. Okay. As soon as you wake up in the morning, drink water. Which leads me to my second point. Try to prioritize sleep. I understand that, sleeping 4 hours because you want to get a head start on work, it sounds like a good idea, but it's really not, and especially for students who think that studying extra and sacrificing sleep is going to benefit them. It is really not going to benefit them. I've been more successful studying 2 hours and sleeping 8 hours than studying, 4 hours and sleeping 6 hours.
Right. Because your brain's tired.
Your body cannot function without sleep. So definitely get more sleep. Okay. My third piece of advice is Let's see. I know what I want to say. I'm just figuring out how to say it.
Okay.
Okay. I understand that many times exercising, 30 minutes, 60 minutes a day is not realistic for many people. But if you try to set up simple habits throughout your day or throughout your week, such as walking, down your street I'd say my third piece of advice is to create simple habits, such as walking 15 minutes or walking 30 minutes after work every day around your neighborhood. If you have a bike, ride your bike for 15 minutes. If your job office is close to a gym, are there 30 minutes once or twice or even 3 times a week that you can pass by this gym on your way home, figure out something that, at this gym that you might enjoy. If it's not weightlifting, if it's not the treadmill, maybe there's like a spin class that you could join. Maybe there's, an aquatics class that you could join, yoga, Zumba. If you have kids, and you have to prioritize your kids after work, go for a walk with your kids. It's healthy for them too. And it's engaging. It's better than them being on their iPad, for sure.
Yeah, I will say.
These little habits add up. 15 minutes, a 15-minute walk, twice a week might not sound like a lot, but look at 40 years down the line, how much walking that is.
I love that. Thank you for that.
Yeah.
Do 20-year-olds need to learn or educate themselves about protecting their body from injury? I know we kind of touched on this, and I feel like, if a joint hurts and you're young, you don't overthink it. But is there a red flag or something that you want to tell young people about protecting their bones, their joints, their muscles, all of that?
So, in my personal experience, I had a shoulder dislocation when I was 16, and it kept dislocating until I was like 21.
Wow.
And I just lived through the pain. I ignored it. I played volleyball. I was a college volleyball player. I played volleyball through my pain. I really just ignored it, and I just pushed it to the side. Eventually, I guess maybe I matured to the point where I decided, that I need to take care of this. Or maybe it was, PT school that made me realize the severity of it. I got surgery, this year for that injury. And I would say if I could go back, I would take it a lot more serious, and I would take care of it early, because now, it's going to affect me for the rest of my life, compared to, sorry. They're done? They're done. Okay.
No worries.
Yeah, so I look at older people who have not taken their injuries or pain seriously, and look at how they're now, facing the consequences of it. And ask yourself, is this something you want to live with, or is this something you don't want to live with? Of course, this is something that nobody wants to live with, but it's definitely tough, because a lot of times people really have to experience things for themselves to understand the severity of it. that's,
I feel you. It's like, if you've only ever endured the flu and someone is dealing with a chronic condition, they're just going to say feel better because that's their knowledge of pain and illness. They've never dealt with something so severe. So I agree with you 1,000%. All right, let's do some myth versus fact as we kind of wrap it up. You ready?
Okay, yeah. Let's do it.
No pain, no gain.
False.
Okay. Cracking your knuckles causes arthritis.
Myth.
Okay. Running is bad for your knees.
Myth.
You should stay in bed when your back hurts.
You should stay in... Wait, say that again?
You should stay in bed when your back hurts.
False.
Okay. Good posture means sitting perfectly straight.
False.
Okay. Perfect. What is one small change someone listening could make today that their future self would thank them for? Long answer. You can... No myth or fact there.
Okay. One small change, you said?
Yes. Small.
Take a cold shower every morning.
Okay.
So to some people that might not be a small change. Some people hate the cold. I do too. But, God, it's so beneficial in terms of, it's so beneficial for your skin, and it is so good for, controlling cortisol levels. I know people make jokes about cortisol nowadays, but it's a real thing that really, really, really will, affect people down the line if they have, chronically high cortisol. So I would say take cold showers in the morning. Try it out.
Okay. I'll take one tomorrow. Sounds intimidating. I did a cold plunge once for like 10 minutes. That was scary. That was horrible. But I feel like it's all in your head though. It's not as scary if you don't think about it.
It is, and honestly, you don't really feel the long-term benefits until you've done it consistently enough. You'll really start to feel the benefits after 30 cold showers compared to one.
That sounds so dreadful.
Yeah, I know it sounds like a lot, but it goes by so quickly. Yeah.
Okay. I'll keep you updated. If I do 30 cold showers and I feel better, I'll come buy you a bagel or something.
Another small adjustment that people could do every day is I don't know if this is small. I would say strengthen your rotator cuffs. You'll thank me in your 50s.
Okay. If we want to, you probably don't do telehealth, right? Because of the job that you have?
I can do telehealth. I prefer not to.
Right.
Especially depending on, the patient's diagnosis.
Okay.
If it's someone who's dealing with something like obesity, then yeah, telehealth does make sense because it's more so, verbal guidance.
Okay.
If it's obviously a condition like cerebral palsy,
right,
I need to be more hands-on.
Okay.
And telehealth is it's just not going to be as beneficial as in person.
Okay. So if we want to come see you as a patient, where can we find you?
I do operate out of New York City, primarily out of Brooklyn, New York City.
Okay.
That's for in-person visits. But I definitely do telehealth calls.
Okay.
I do telehealth calls, but if I don't see it as more beneficial, if I see it as not as beneficial as in person, and in person is an option, I will not suggest it over in person.
Okay.